Welcome to the Clinical Cantonese 臨床廣府話 provided by Family Care Physiotherapy Clinic. Today is the 2023. COVID-19 pandemic is over. Then one is over, one comes back. Yeah, it's flu season. Today we talk about flu and cold. Flu and cold in Cantonese is one is called 感冒. The other one is called 傷風. Clinically, it's very hard for the layman to differentiate that because the symptoms are very similar. So I don't want to go through the medical jargon. In Cantonese, we use either one is quite interchangeable, so we don't struggle too much. And today we ask about the symptoms. So in asking about the symptoms, very easy basic term is do you have, how to ask, 你有冇? In later, a lot of symptoms, as a clinician, when you ask your patient, you will use this term very often. 你有冇? Okay? First, the major symptoms, before we really get all the symptoms of flu, is sore throat. Sore throat in Cantonese, we say 喉嚨痛. Throat, the 喉嚨. Pain, we call it 痛, as you can recall it in the pain lesson. When we have sore throat, we know that we are in trouble. So we better do something to take some relieving medicine and consult the doctors as soon as possible. Sore throat, 喉嚨痛. The other two are about the nose. For minor symptoms, is running nose. In Cantonese, we call it 流鼻水. Water comes out from the nose. Then for more severe, that we have difficulty in breathing. Blocked nose. Blocked nose in Cantonese, we say it 鼻塞. The nose is blocked. These two symptoms are more regarding to the nose. And the next one is a little bit more serious. It's fever. Fever, a lot of disease, they are fever, but sometimes flu and cold only face severe case, you have fever. Fever in Cantonese, we call it 發燒. In previous lesson, we learned about that. Do you have fever? In Cantonese, the whole sentence we ask, 你有冇發燒? Similar to the previous symptom, you can ask in the same way, then you can ask all the symptoms already. Similar as fever, coughing is also very common. In COVID-19, we have coughing. In flu, we also have coughing in the late stage. Coughing, we call it 咳. Just one syllable. 咳. Do you have coughing? 你有冇咳? In Asian culture, now, even at this moment, 2023, we so much expect if you have coughing, you better wear your mask in the public area. For this short and sweet lesson, we come to the last slide. In Cantonese culture, I need to take care. I'm a physiotherapy, a Western trained healthcare provider. I'm not traditional Chinese medical provider, but just in terms of culture, this is a simple term I teach you about Chinese culture and Cantonese. For Chinese medicine, after you see a traditional Chinese medicine, they prescribe you the Chinese medicine according to the symptoms. Those Chinese medicine is called 中藥. In other terms, usually it's mixed up in Cantonese culture. No matter we are really in sick or not, we just want to adjust our body condition, balance our body condition, we usually drink some herbal tea. Those herbal tea are not under prescription and the effect is not that strong, and so that's why this is easy to take it. We sometimes just take it for wellness only. Those herbal tea, we call it 涼茶. 冷茶. To be specific, two are different. One is stronger, prescribed by traditional Chinese medical practitioner. One is for general wellness. You don't need prescription. A lot of mothers, fathers, because we know the Cantonese structure, so we already know the common formula. So the Chinese medicine one, by the doctors one, 中药, 中药. For the herbal one, no need prescription, very general wellness one, the herbal tea drinking, 冷茶, 冷茶. Hope through this lesson you can understand the difference between the two. Thank you for attending the lesson. I wish you all the good health.